Welcome to our online parent information session. My name is Tanya Rose and I'm a member of the speech pathology team here at Peel Language Development School. This presentation is designed to provide you with information regarding our referral process and answer some common questions about our school and service. I also invite you to view our school video. This can be found on our school website. It will allow you to meet some of our staff, including our principal, Fiona Forbes, and hear more about our language and learning programs. I would like to start with an acknowledgement of country. We acknowledge the traditional custodians of this land where Noongar people performed age-old ceremonies of storytelling, music, dance and celebration, and where they cared for the lands and waterways. We acknowledge and pay respect to the elders past and present and acknowledge those of the future, for they hold the memories, traditions and hopes for all Aboriginal Australians. Always was, always will be. Peel Language Development School is a government-funded primary school for students with a diagnosed primary developmental language disorder, or DLD. This means that the child's primary difficulty is with language and that the difficulty with language is not associated or caused by any other biomedical condition. Our school is staffed by highly trained teachers, education assistants, speech pathologists and a school psychologist. Applications to our school are accepted from kindergarten through to year 1. Our service is available until the end of year 3, then students transition back to their local mainstream school or preferred school. There are 5 language development facilities across Western Australia: Peel Language Development School, North East Metropolitan Language Development Centre, South East Metropolitan Language Development Centre, West Coast Language Development Centre and Fremantle Language Development Centre. A valuable part of our service to the education community is our statewide speech and language service. Each of the 5 language development facilities across WA have a speech and language service. The Peel Language Development School team provide an outreach service to over 140 schools across the South Metro, South West and East Kimberley regions. The aim is to strengthen the language expertise available to students and provide greater support to schools and teachers through professional learning models and early intervention programs. In order to attend a language development school, a referral must be completed. As explained before, we are a government-funded primary school for students who have a primary language disorder. A speech pathologist is the person who diagnoses a language disorder, and so in order to apply for a place at the language development school, your child will need to be assessed by a speech pathologist. Hopefully, if you are watching this information video, then you already have a speech pathologist involved with your child. If you don't, accessing service from a speech pathologist is essential in order for an application to be completed. We are very lucky here in the Peel region to have an amazing group of speech pathologists working in both the public and private sectors who are very knowledgeable about our school and know what assessments need to be completed in order to apply for a place at the Language Development School. Your child's speech pathologist will assess their receptive language, so their understanding of language or their comprehension, and also their expressive language, the way they get their message across. Some children may only experience difficulties with one of these areas, while others will have difficulties with both. Based on the assessments completed, your child's speech pathologist will determine if a language difficulty is present and if an application to our school is appropriate. In addition to the speech pathology assessment, we also require a parent checklist to be completed for children applying for a place with us for kindergarten, and a teacher checklist will need to be completed for those students applying for a place in pre-primary or in year 1. All school-age children also require a cognitive assessment as part of their referral to our service. Children with average or above average cognitive functioning, combined with a language difficulty, are eligible to apply. A non-verbally administered assessment is recommended as it measures the child's skills without as much impact from language as other types of assessments. Assessments are often completed at the child's school, but it is important to note that this is subject to the procedures at the school, including the current workload or caseload of the school psychologist or other demands that the school may have. Alternatively, these assessments can be completed privately by a psychologist in the community, and parents can speak with their GP, the child's teacher, or speech pathologist for more information. Non-government schools also have access to a psychologist who is able to complete the required assessments for an application. Something else to keep in mind is that an application to our school does not guarantee a place. Each year we need to look at the amount of places that we have available and the number of appropriate applications that we receive. The placement panel usually meets in October to discuss referrals, and following this, places to the school are offered. Because at the time of application we cannot guarantee you a place, it is really important that you also enrol your child in your local or preferred school. This is to ensure that they don't miss out on a place at school, especially for those students who will be entering kindergarten. If your child is accepted into the language development school, you simply let your local school know that your child will be attending a specialist program instead. Something that we always like to explain to our families is how the speech pathology team here at the Peel Language Development School works, as it is quite different to the way that speech pathologists in the public and private sectors work. You are most probably used to attending speech pathology sessions with your child in either a one-on-one session or small group sessions. Here at the Language Development School, we don't provide any one-to-one therapy. This is because we are not a therapy service provider. We are an educational facility. So if you look at the diagram on the screen, we do not provide any Tier 3 intervention. What we do provide is Tier 2 intervention, so that is small group sessions within the classroom, and we also provide Tier 1 intervention, so whole class instruction. We also spend a great deal of time assisting our teachers to develop language programs, as well as upskilling staff and parents through information sessions. We also complete assessments and help teachers develop individualised programs for all of our students. Sometimes it can feel quite confusing or overwhelming trying to get your head around what oral language actually is and what the difference between speech and language is. This is what I will cover in the next 2 slides. When we talk about oral language, we are looking at 6 different areas or skills that all come together to help us be competent oral language users. The 6 areas of oral language are comprehension, so that is your understanding of language and includes following instructions and understanding and answering questions. Semantics, so our knowledge of words and their meanings, essentially our vocabulary. Grammar, the rules of language and how we put our words together to ensure that we are grammatically correct. Pragmatics, being our social use and understanding of language. Oral text or narrative, our storytelling skills, and this includes being able to recount personal events. And phonological awareness. This is our understanding of sounds. Letters have sounds, we put these together to make words. These are the building blocks for reading and spelling. Speech, on the other hand, is the way that we pronounce our sounds. You may have also heard it being referred to as articulation. If your child has difficulty with their speech or articulation, perhaps they say tat instead of cat, or maybe they have a stutter or have been diagnosed with dyspraxia, this means that they have difficulties with their articulation of speech sounds. That doesn't also mean that they won't have a difficulty with their language skills as well. A number of our students fit into that middle part of the diagram on your screen, where they experience difficulties with both speech and language. What is important for you to know, though, is that Peel Language Development School offers an early intervention service for language. So if your child's primary difficulty or main concern is their speech sound difficulties, then the language school may not be an appropriate place for your child. Your child's speech pathologist will determine this as part of their assessment. For students who have difficulties with both speech and language, and like I said, we have a number of these students with us, then you may still need to access external support for your child's speech sound development through your public or private speech pathologist if the difficulties are significant. Again, this is because we do not provide any one-to-one therapy here at the Language Development School. And also our core business is working on developing your child's language skills. Your child may need to continue to be supported by an external speech pathologist to help develop their speech skills. So if you receive a letter offering your child a review, please respond and attend the appointment. It is about working together as a team to ensure that your child gets everything that they need. In addition to targeting oral language skills within the classroom, all of our teachers also follow and teach according to the Western Australian curriculum. As discussed earlier, we have classrooms co-located at 4 different school sites. The schools are Rockingham Lakes Primary School, Bungaree Primary School, Mandurah Primary School, and Pinjarra Primary School. The site that you attend is determined by your residential address. This slide lets you know the catchment area for each school. If you have any questions regarding this, please don't hesitate to contact us. As the campus that your child attends may not be your local intake school, you are entitled to a conveyancing allowance or access to the bus service. Applications for the school bus service or conveyancing allowance need to be submitted by the family on the school bus service website upon acceptance to the Peel Language Development School. This is to ensure that the conveyancing allowance is paid for term 1. The bus is a door-to-door service for Rockingham Lakes Primary School, Mandurah Primary School, Bungaree Primary School, and parts of Pinjarra Primary School. Pinjarra Primary School students also have access to the Transperth buses. However, the Transperth buses operate from bus stops and don't have carers on them. During enrolment, staff will be available to help you complete the application for the school bus service or the conveyancing allowance. Please note that Peel Language Development School do not determine which students are accepted onto the bus. The school bus service determines this based on your address, the number of students, and the maximum amount of time that students are allowed to travel on the bus. If you have any questions about the bus service, please don't hesitate to contact us. The closing dates for applications for next school year can be seen on the slide. As mentioned earlier, please make sure to view our school video located on our website so that you can meet our staff and hear more about our learning programs. We hope that you have found this information helpful. If you have any questions at all, please don't hesitate to get in contact with us. Our phone number is 9523 7830, or alternatively, you can send us an email to the address currently on your screen.